Hello and welcome to the CDO Magazine interview series. I am Mike Kaiser with Centric Consulting, and today I have the pleasure of talking with Bhavna Mehta, Assistant Vice President at Cincinnati Children's Hospital Medical Center. When you're facing a situation where you need to implement a data initiative and it requires significant change of the people that are in the organization, can you share a successful change management story related to a data project?
Yeah, so I think one of the biggest changes that I'm leading right now is honestly, we're moving from a siloed operating model from organization perspective to more of a federated operating model. So we have implemented what we're calling it our data and analytics ecosystem, where we're implementing a data fabric and a data mesh, right? If you're, aware of where we have about 100 analysts who are across the organization who have been traditionally working in their own systems. Some connected, some disconnected. So the way I'm positioning our team is more of a center of excellence. So I'm part of our corporate IT group, and so really making sure that my team is responsible for the platforms, infrastructure, the processes, and we're rolling out, infrastructure that's available for self-service, which then means that, all the analysts embedded in our divisions, whether it's, neonatology or cardiology or pulmonary medicine, right? Different analysts in different divisions are now able to leverage that platform and work on it. And also that gives us the mass scalability because they can share, they can come together. So we had kind of started that process back when we started our data governance program, which really created a community of practice for data stewards to share, definitions and concepts. But over the last year, with this new technology change, it has been a huge shift. But now we're asking folks to say, okay, you're going to learn new things, right? A new technology. We also announced decommissioning as we're modernizing decommissioning of our old technology, which means there's a timeline too. But there's also balance around how do I meet my operational obligations with getting the time to actually learn new stuff. So this whole entire change, I think you can think about the organizational commitment and communication that's needed, and it's ongoing, right? So, I went on a lot of road shows, first drafted the strategy, value, how we're going to do it, went on road shows, multiple teams, making sure that people at the leadership level get the message, then team meetings for the impacted analysts, right? And then one-on-one meetings. My team is hosting office hours. We have communities of practice enabled. We have newsletters. We have different forums to actually get feedback, and we have taken feedback. So that's really important from a change perspective, that we are responding to feedback. And one of the things I've often believed in, right, that people scream because they care. So if things are not good and people are telling you they're not good, we have to listen. Because if we are not listening, then it's obviously there's no value in it. And oftentimes, from a change management perspective, I also believe that it's either folks don't understand the value of the change, the why behind it, or they can't get past the barriers that it would take to implement the change. So I think really leading with empathy and leading with transparency, which is what we're doing here, to say, hey, we're honest, we're all learning together, so we will make mistakes, let's just come along. So I think that has worked, Mike, and we are starting to see some really early successes of the scalability that we hope to achieve.
That sounds great. The when you're talking about putting forward a strategy and overcoming that resistance, you're talking about the communication that you're doing, making sure people understand the whys, making sure that if they've got barriers to being able to move this direction, you're helping to remove those, that you're getting feedback from them, most importantly, so that you can understand where they might have barriers or a communication gap, that you're bringing that empathy and bringing that transparency and being willing to change. I think those are all amazing techniques. I guess when you're thinking about gathering that feedback, is that most often through a survey, or have you found benefit in getting feedback in other ways?
I think many different ways. We've done surveys. Like I said, my team actually leads, so our lead architects of the different areas They lead communities of practice. So we actually have a data virtualization work group that meets on a monthly basis, where we share what we've done, what we are, and what feedback and what changes have we made, how we're responding. There's a team site, they can actively post on that. There are twice a week office hours where people come in and they are staffed by my team. So we're doing that both on the data management side, as well as the data engineering, data virtualization side, as well as on the business intelligence. We just went live with Enterprise Power BI. So, there's a lot of conversation around that. We did Alation as a data catalog. So that's our tool stack. So we have office hours and support across the board. There's also a lot of one-on-one coaching, small team meetings. Honestly, my team, I have an incredible team, and we accept feedback in whatever way we get it.
That's great. That's wonderful. I guess in wrapping up, a question that I have that I'm really curious about is what makes you excited about the future of Cincinnati Children's?
So we are, I think, at an amazing place. We have a very strong vision, mission, a strategy that people, believe in and understand where we're headed. We have amazing leadership. Our executive leadership, I think, is just helping us all drive together on the same path. And then the promise of technology. I think the opportunity that we have in terms of just transforming care with new and innovative models, as well as even making more efficient in how we deliver care today, and the possibility of just increasing the impact, right? Reaching out to many, many more kids locally, nationally, internationally, and just change the outcome of so many more kids than we have been so far.
Thank you, Bhavna Mehta, for joining me today. And for anyone listening, please visit cdomagazine.tech for additional interviews.
Thank you, Mike. It's a pleasure.